So it would have been about college time, and the decision of whether to keep the baby or not was really hard. I was stuck in the middle because it's like one way I'll have a baby, but that's scary, and the other way I won't, but that's also really sad. And I had a lot of different outside sources that eventually the fear of I'm going to be alone with the baby, and the outside sources of why are you doing this, you're ruining your life, kind of led me to my decision of not keeping the baby. After my first pregnancy and abortion, I thought I'd feel this overwhelming sense of relief, and it was the complete opposite. I was devastated for a very long time, and it took me a lot of work and prayers to get to the place to tolerate my decision. And I think the biggest thing when it comes to abortion is to know that it's not the easy way out. And just because it seems like it might be the easy way, there's still a lot of pain that goes with it. So when I found out that I was pregnant with, again, it was really scary. I did the same cycle of do I keep her, do I not, do I keep her, do I not. I found Marisol one day when I was having a rough day, and I needed somebody on the outside to kind of break down all the options for me and listen to my thoughts as well. And so I Googled, Marisol was the first one that popped up. So something that I really liked about Marisol is that they could get me in that day, and that they were like, come on down. And so that day I went in. Marisol Health, first of all, they give you a free pregnancy test, which is really nice because they're also there with you when you find out the results. So if you're scared, they can kind of be there with you to walk you through it.
The first time that Kendall was here, she was definitely scared, and I think she was very nervous about what the consequences of this pregnancy, what those consequences would look like in her life. And so in those critical moments, we can provide support, assistance, encouragement.
It's our inception of Marisol Health. We have seen over 2,200 patients. Of those, 1,500 of those were pregnant individuals, and then of those, we've seen over 480 women for prenatal care. 2/3 of those individuals are what we would consider abortion vulnerable.
My goal from the first time that I meet with a family is to explain to them how we operate. We are very unique. We're a unique model, medical and social services wise. And so from the get-go, I want the families to know that we do provide all of those services like housing and direct assistance by way of diapers and wipes and clothing, as well as transportation to their appointments. So there's a lot of different resources that are available, and so I get to build a friendship, a relationship with these families so that I can understand how to best help them and fit in those resources as they need them.
I knew in my heart that if I did not keep her, I would hate myself, because I had already been through that once, and it was not an easy way out for me. They really helped me figure out exactly the direction I need to go in. They make sure that you feel comfortable, that you're gonna have enough food, clothes, everything that you would possibly need for a baby. So they really stay alongside you throughout your pregnancy, and they call you and make sure that you're doing okay, and they check in on you, which is really nice because every week I would get a call from Maria or Paulina saying, hey, are you okay? So that was really nice to know somebody else was there cheering me on. I think the first thing that I would say to other moms in my position is, I know it's scary, and I know it can feel very isolating and like you're alone, but you're not. And there are people out there who are willing and wanting to help you. And you don't have to feel so panicked, because there's a solution and there are ways to get through what you're going through.